Hello everyone, and welcome to this audio audio podcast. And in this sort of audio podcast series, or part of the science of Traption and the Bostix Ruptre, and an audio podcast aligned to the Bostix feature, and this is an audio podcast in around the Bostix feature 3. This is another chartered edition and another evidence-based audio podcast, and another audio podcast aligned to another Storm the Bostix production. And what I thought I'd do here is in following the sort of audio podcast series that's just taken sort of place in and around aspects of pediatric nephrology, and aligned to some aspects of research that had retrospectively taken place in between 2010 to 2013. I thought here I take this opportunity to sort of highlight some aspects that align to aspects in around social media, aspects around social media, but also in around aspects surrounding discrimination and ignorance towards patients with long-term conditions. And this works had been published in around 2016, and the full works has been referred to as "Can Social Media Reduce Discrimination and Ignorance Towards Patients with Long-Term Conditions?" And where the authors in around this works had used a chronic kidney disease example in the UK for a basis and a perspective, and basically what I thought I'd do here as part of this, the Bostix feature 3, is highlight some aspects in around this this publication, and as per the other audio podcast, Science of Traption and Bostix Ruptre audio podcast. Online there will be some resources available, so listeners can check out some of those resources as and when. So a little bit about this particular works in around "Can social media reduce discrimination and ignorance towards patients with long-term conditions?" And where the authors use a CKD example in the UK, but also provide a perspective, more generally. To begin with, I suppose in this to begin with, I thought to begin with this works, I thought it would be an idea to highlight some aspects in around the introduction around this. So the UK is so a social media platform referred to as, or what has been referred to as, the RPSG, or the Renal Patient Support Group, has revealed many features of unacceptable service and support towards renal patients in multiple areas. These have been previously reported in a paper, in a special poster presentation in and around what's been referred to as in a particular remit, and for purpose of for purpose of confidentiality, I won't it will not be highlighting where this particular poster presentation was highlighted. But however, suffice to say, the works outline two sort of main themes through some fundamental discussions through the RPSG, or the Renal Patient Support Group, sort of retrospectively in around number one, lack of awareness, education and understanding. Number two, disease sensitivity and recipient or patient experience or patient experiences, and these themes highlighted further highlighted examples of what is technically against national and international law, known formally as has been referred to as discrimination, and often based on more fundamental on a more fundamental basis as ignorance. So in and around renal groups have had begun to identify potential waste around such sort of aspects in around the challenges around healthcare, around aspects of healthcare, and where patients and carers, for example, were highlighting aspects in around healthcare through social media, and in context, this has been in context in around this is an illustration of a sort of a broader concept, if you like, of the use of assistive technologies in some regard, starting to help for example, patients and families at a very direct level, and increasingly amongst patients sort of around the world. The patient and public involvement approach, or what's been referred to as PPI, at NHS, National Health Service England, are beginning or had begun to take some note from a required where NHS England, had begun to take sort of note. And reinforcement may well come from a requirement to make communication easier in healthcare, including communication channels and platforms like social media, known as the Accessible Information Standard, or what's been referred to as AIS. So in around the objectives of this works, or at least where authors in around this works had highlighted, the works seek to use chronic kidney disease, or CKD, as an example to other long-term conditions, and in around this, the authors had looked to explain to sort of highlight sort of specific experiences and consequences in context of discrimination and ignorance. And above all, the article or the works that was published again in 2016, listeners, and again, listeners, you're welcome to check out the resources in on social media around this, where for example, the published works look to show or highlight what has already been achieved and which with sort of healthcare in context of the healthcare or healthcare system could well be could also be could also be a sort of a basis for could well be sort of a sort of a basis or a model basis for sort of future sort of developments. And so highlighting some introductory aspects, and then the sort of the remit, if you like, in around the objectives of this works. I'm now going to highlight some aspects in around this in context of long-term conditions. So in context of long-term conditions, but also in context of disability as well. And so in context of long-term conditions and disability. So retrospectively, there have been an estimated 15 million people in England alone that have at least one long-term condition, or what's being referred to as an LTC. Patients account for about 50% of GP appointments, 64% of outpatient appointments, and around 70% of hospital admissions. Hospital admissions or hospital bed days, and around 70% of total health and care expenditure in England is attributed to people with long-term conditions, and people diagnosed, or those diagnosed with a number of long-term conditions have been in literature have been referred to as the most intensive service users or service users of all people of health in around aspects of healthcare, because needs are usually, or had been usually more complex than those with single sort of diseases. Most people age so in around this, most people age, for example, 65 and over have been documented as having a sort of a multi-morbidity, although a Scottish investigation have identified the absolute number of people with multi-morbidity was higher in those aged also under the age of 65, indicating in its implications for the population as a whole. And so the number of people with multiple long-term conditions, and what's been evidenced and referred to as what has been referred to as multi-morbidity has been set to increase from for example 1.9 million in 2008 to 2.9 million in 2018, and obviously prospectively the epidemiology around population and population health where research has taken place by various researchers looking at sort of aspects of population health sort of prospectively may well have sort of increased to an extent, so thus potentially more than 2.9 million in 2018 to 2.9 million plus in the current year. So this consequently has an impact beyond healthcare itself. And so long-term conditions also prove to be within another special class. So in this works, according to a particular resource, according to a particular resource, Article 1 of the United Nations Conventions on the Rights of Persons with Disabilities, UNCPD, and as persons with disabilities include, so for example, those people, those who, this is a direct quotation now from the UNCPD in context of persons with disabilities, which includes those who have long-term physical, mental, and intellectually or sensory impairments, which in interaction with various barriers may hinder their full and effective participation in society on an equal basis with others. So that's a sort of a direct quotation from the UNCPD and Article 1. And the World Health Organization, or WHO, Global Disability Action Plan, in context of the UNCPD, also is important. And a direct quotation in around what the WHO, or World Health Organization, have highlighted is thus: across the world, more often than disabled peers, people with disabilities do not receive the healthcare they need or require, and have do not receive the healthcare they need and have poorer health. People with disabilities are more than twice as likely to find healthcare providers, skills, and facilities inadequate, nearly 3 times more likely to be denied healthcare, and 4 times more likely to be treated badly. And so in following specifically in the West, persons with disabilities tend to report more access to healthcare problems than persons without disabilities. These problems tend to be most important. These problems tend to be issues or problems tend to be most important and common amongst those with poorest health and those with the most severe disabilities. And according to works by Dranoni and team, it has been imperative that healthcare and policymakers, planners, and providers sort of understand and address the needs of people with disabilities as a distinct category of healthcare sort of consumers. So putting all this in context now for this works, and where the authors then look at the works in from a basis where the prevalence of in around CKD, or chronic kidney disease, and cancers, and other sort of conditions or health conditions in context of population health have been rising or increasing. And so in line to this, and sort of what's been sort of highlighted per previous audio podcast series, in around coping strategies, for example, in aspects around sort of the coping strategies and young people in CKD. So coping strategies also have a role to play living with a particular long-term condition, especially for young people. And so now, in specifically in context of the remit of this works, is some context in around discrimination and ignorance. So discrimination and ignorance from the UN Convention on the Rights of Persons with Disabilities. Discrimination has been defined as and this is a direct quotation from the UNCPD. The UNCPD, where they have defined discrimination as any distinction, exhaustion, or any distinction or exclusion or restriction on the basis of disability, which has the purpose or effect of impairing or nullifying the recognition, enjoyment, or exercise on the equal basis with others of all human rights and fundamental freedoms. So, in line with this, then discrimination in the UK or the United Kingdom is more explicitly defined as distinguishing differences between treating someone as inferior based on their race, their sex, their health backgrounds, national origin, or other characteristics. There have been signs of developing focus on. There have been sort of signs of developing focus on discrimination in line to sort of related in regards to relatable literature. This may have in line with this may be seen as a consequence of stigma, which acts on a disadvantage which acts on the disadvantage of people who feel denounced. The importance of discrimination has been sort of transparent for years in terms of personal experiences of service users having devastating effects on relationships, parenting, and childcare, education, training, work, and housing, for example. And there is evidence too directly from there is also evidence as well directly from the health profession as well. So according to a poll commissioned by the General Medical Council, or GMC, more than half of doctors or physicians who sort of took part in this particular poll had thought and think that patients with a disability receive a poor standard of healthcare. More than 1 in 3 physicians reported that they actually had witnessed a patient with a disability receiving poorer care or facing some form of discrimination. This confirmed MenCap's, an organization referred to as MenCap, MenCap's claim that the NHS or National Health Service is still putting lives at risk by failing to adhere to the UK Equality Act. Now, in line to this, relating to discrimination as well is ignorance, and so ignorance in this context is a state of being uninformed or having a lack of knowledge. The word or the terminology ignorant is an adjective describing individual people in the state of being unaware. It is often used as an insult to describe individuals who deliberately ignore or disregard important facts. Ignorance can thus be defined as having a lack of awareness, education, or knowledge regarding to people with a disability or a long-term condition. A more honest admission of ignorance might mean an increase in awareness and understanding of real issues and concerns that patients have in context of health health services. And from this evidence, or from the evidence, there needs to be an improved access to knowledge, sort of more sort of improved access to knowledge or knowledge bases for service users and service providers, especially where people with long-term conditions or disabilities still face challenges. And in some, this also means sharpening focus on human rights upon discrimination and ignorance as actually experienced by people with a disability or a long-term condition accordingly. Now, in line to this, so authors had also sort of documented some aspects in around assistive technology, illustrated by social media. So I'm going to highlight some aspects in around this as well. So one way of improving awareness of discrimination and ignorance for a disability or long-term conditions for employers, for example, service users and providers, policymakers and health professionals, is pointing them to information and resources where they can gain real experiences and understanding. More awareness to preclude discrimination and ignorance can perhaps be achieved through information and communications. Technology, through information and communications technology, or ICT, social media, and assistive technology. So in around this, the working definition for assistive technology, for example, in health, in aspects of health, spanning nearly everything, has been quoted as the following: any product or service designed to enable independence for disabled and older people. The definition was refined for the digital world by Stephen Hawking in his acceptance speech at Ability Nets, and the tech for goods in his acceptance speech at Abilities Net, and the Tech for Good Awards, which remind us that technology has a pivotal or vital part of human existence. And in around this, the works around ICT or information communication technology, shows that the right tools in the right hands can help everyone, regardless of frailties, to achieve true potential and advance as a civilization. Now, in around this, I'm now going to highlight some context that sort of surround assistive technologies, but now sort of in and around social media. So social media fall within both the King's Fund and Hawkins definitions. So usage has sort of grown exponentially, with sites such as Facebook, Twitter, Instagram, and others now representing sort of 20% or potentially more of time online, or representing 20% or more sort of online. And so, not surprisingly, people with disabilities and long-term conditions seek peer-to-peer support through social media, which offers advantages over standard forms of access. Which offers advantages over standard forms of information, and also accessibility, immediacy, and offers an opportunity for service user for service user sort of interaction. The overwhelming use of social media into lives necessitates a renewed commitment to the changing the way society addresses the use of social media or media to raise awareness in topics of disabilities and long-term conditions and preclude feelings of discrimination and ignorance. In around this, the use of ICT, again, information communication technology, and highlighting challenges living with a disability or long-term condition through social media is important for most service users. Many, for example, want to be involved to prompt issues like ignorance and discrimination, which can be overwhelming. And there is compelling evidence that service users who are active in sort of managing aspects of aspects in around healthcare have better outcomes than those who are merely passive service users or passive service recipients. The use of the use of user-friendly ICT and services is also important for knowledge and resource acquisition and for integrated and what's been referred to and documented as integrated care. User-friendly ICT services also allow the delivery of better understanding, enhancing care quality efficiencies across care providers to enable better service user outcomes. Now, in context of what's been discussed thus far, the authors then go on to talk about or highlight some aspects in around CKD or chronic kidney disease, and using CKD as an example. So CKD is a long-term condition that essentially has been described as the gradual, usually permanent loss of renal function over time. In this research that the authors have sort of distinctively highlighted or have highlighted the different forms of CKD in context of severity, and the basis in around the severity. So, for example, where the authors summarize typical deterioration in context of CKD severity based on renal function or the kidney's inability to filter blood the kidney's inability to filter blood, where this inability to filter blood, this has been referred to as the glomerular filtration rate, or GFR. And so the resource in around this works will be in the descriptive. So I'm not going to there won't be a particular overview in around the severity and in around the severity and the aspect in around the glomerular filtration rate. But early in the disease process, those with CKD can often experience no symptoms. CKD has for a long time been an underdiagnosed disease. Even in the absence of symptoms, CKD appears to add significantly to the burden of, for example, cardiovascular disease or CVD, and death or morbidity. Although there is no age limit, or race that is taken by CKD or chronic kidney disease, the incidence of disease has been changing. In addition, the age of patients entering into CKD increased progressively. Unfortunately, most of these patients most of these recipients and patients are referred to a nephrologist, a nephrologist only at a time when renal function is close to the level where, for example, renal replacement therapy, for example, hemodialysis, is required, and that is when not too much can be expected from or of conservative kidney protective treatments. So in around this also over the last few years, if not a little bit, sort of more retrospectively, collaborative efforts have sort of enabled by common sort of definition of CKD, have provided a description of in around the epidemiology and natural history of this particular disease, thus improving understanding of pathophysiology as well. And there is increased recognition that CKD is encountered by multiple settings and in all age groups, and that its cause and that its sort of disease pathway and outcomes are influenced by the severity and duration of the pathway. The effect of CKD on individual patient and the resulting societal impact or burden that ensues for long-term that ensues from the long-term sort of effects of this disease has been sort of documented in the literature as causing prompt for scrutiny around scrutiny around CKD, and there is evidence of marked variation in the management of CKD due to the lack of awareness and absence of standards for prevention, early recognition, and intervention. Analysis of recipients with unidentified CKD, for example, suggests that the risk profile may be different to patients with identified CKD. This is another area that has required research, and the emerging data point to an urgent requirement for a global effort to highlight that CKD is preventable, its course is modifiable, and its treatment can improve outcomes. Now, in around this, I'm going to attempt to highlight some works in around what have been documented as sort of two examples in context of CKD, So to begin with, on this basis, in around what's been referred to as the Renal Patient Support Group, or the RPSG, and there is emerging research to inform how social media can integrate healthcare. One example of a well facilitated social media platform and in around raising CKD awareness is the renal has been referred to and evidenced as the Renal Patient Support Group, or the RPSG, which is primarily what's been referred to as a closed Facebook group, and was initially established in 2009, primarily by two patients, and one long-time carer in the southwest in the UK. The RPSG is primarily service user based, and also carer led, if you like, and the RPS in around this in this paper from 2016, the RPSG had sort of had a sort of had a service user service user basis of just under 7,000 service users at that time, or at least it was documented as over 6,500 service users at that in around 2016, and there are now there are in around this there have been 10 moderators or administrators that form part of the sort of part of the administrative or moderating team in around the RPSG, but also wherein some of the excuse me, wherein some of the members also form sort of the research the research team, with the representation from the UK, Europe, Australia, and the USA who are responsible for the RPSG. The RPSG offers primarily online sort of peer support, or at least sort of as a fundamental basis, primarily sort of peer support sort of globally or internationally with service users, providing insights on sort of experiences. So the RPSG is also as mentioned, where there's where for example this works was works that had been developed by authors in 2016, and where the authors had been collaborators in around different in between sort of the RPSG and other sort of collaborators, and wherein the RPSG in this context had been sort of research active as well. And so since the RPSG is mainly had primarily mainly been a sort of a Facebook platform, it lends itself well it has lent itself well to raising CKD sort of allowing awareness and allowing members, service users, to share stories and experiences and lived experiences, and at the same time the RPSG is referred to by other organizations, or have been referred to by sort of organizations that relate to sort of nephrology, if you like. So for example, the National Kidney Federation, and also an organization sort of referred to as renal patient view, or patient view, and in line also, the RPSG thus also allows a platform for all service users to share issues and experiences, starting with the very service users who suffer with CKD. And so, in line with it, aligned to this as well, whilst the RPSG may have some initial challenges collecting data owing to recipients or participant motivation and enthusiasm to get involved, using social media has also offered an opportunity to the general public, service users and service providers, to share experiences and understanding as perhaps never done so before. The RPSG, one of the RPSG slogans that has been documented in this works is where the authors have said the RPSG slogan is a place where awareness and research meet, and the RPSG has set a precedent for more renal patient support groups to become sort of proactive through Facebook, and the RPSG also the RPSG, at least that has been documented in this works, has been the RPSG has also been sort of streaming, if you like, in across various other social media platforms since 2009, and so thus where platforms where social media platforms for example, may well be more approachable to academics and researchers than, for example, to academics and researchers where non-Facebook, where, for example, academics and researchers may well not be inferred as, for example, and specifically as sort of Facebook users, and so the RPSG has had implemented since 2009 other social media platforms for academics and researchers to interact with aspects in around the RPSG, and so in this context, to provide academics and researchers and non-Facebook users an understanding of the different sort of activities. So in around this, so that's the RPSG, at least in works that's been documented here, has a basis in around the adult nephrology or renal population, and now I'm going to provide a little bit of perspective based on what's been published here in this works from 2016 in around the kidney disease and renal support group, or KDARS for young people with CKD. So KDARS is a parallel Facebook support group highlighting CKD awareness, more specifically in young people or for young people with CKD who face a lifetime of illness, and following on from the experience that two parents had gone through with regard to one of their children, or one of their children who had been diagnosed with a specific form of AKI, or acute kidney injury, for several months, and wherein the founders of KDARS then discussed the notion of initiating a support group to provide peer support and sort of a way for better communication and pathways for service users with a child or children who are in CKD. And the parents initially composed several bulletins and stories approaching local newspapers, and making an effort to highlight their particular sort of story. The parents, the founders struggled to get any response, and initially had very little success. It was then that the parents contemplated setting up a sort of a social media group or platform for families of youngsters living with CKD. The parents endeavored to scan for other non-Facebook support groups specific to young people, or pediatrics and young people, and also identifying that there were no sort of and quick and sort of what they had identified, and what they had identified, whether there were no specific groups or social media platforms in around this population on social media in that time, in around that time. And it was actually specifically, and it's been documented in this works, on the 28th of April 2014, KDAS was formally founded. KDAS for Kids has been a sort of a support platform for patients, parents, guardians, and carers, and babies and toddlers and young people affected by CKD. Now, as parents of a young girl who had been diagnosed or suffered with a form of CKD at birth, since birth, and had struggled on a daily basis. The founders had known how challenging and lonely and isolating living with CKD had been, and in this works has been referred to as sort of a life sentence, and through founding KDAS, the founders had hoped to encourage families in similar circumstances to share experiences and stories, to offer support in challenging times, and to highlight that parents and guardians, service users are not alone. And in line to this as well, the KDAS group, the KDAS social media platform, aims to fill a gap, a so-called gap in the market, if you like, to offer support to parents and guardians and service users who have a child, for example, in the ages of anything between neonate at 0 at 0 to up to 17 years of age. And this is where the support is often neglected, has been often neglected and needed most. KDAS have recently reached in this works that was published in was published in by authors, where this work was published by authors, or where the authors had this work published in 2016. At that time, KDAS had over 500 service users worldwide or globally, with members with members being from service users being sharing sort of experiences in around from Europe, East Asia, and USA, as at least some countries. It is now known that KDAS has close to or near 2,000 service users sort of internationally. And so whilst utilizing social media in around this, so whilst utilizing social media does have some advantages, the founders of KDAS, for example, had wanted to be on the front line in order to offer a more face-to-face service to highlight more crucial topics in relating to young people suffering with CKD, and parents and guardians who for example, have their own sort of challenges, and this includes topics relating to regarding to CKD awareness, chronic kidney disease awareness, discrimination, and ignorance. The KDOS founders have been offered a in around this as well. Or when this work was published, KDOS founders had endeavored to identify suitable physical premise to thus in a way to offer sort of service users a sort of space a space to share experiences, etc., outside of social media, outside of sort of the social media remit, and quite successfully KDOS had sort of founded a sort of an associated aspect to KDOS referred to as the pit stop, and basically a pit stop or KDOS pit stop is a way where the founders have a space or physical space where they offer tea, when they offer tea, and also offer support in a physical space from a sort of educational basis where service users, parents and guardians, etc., at pit stop can access some of the educational bases in around CKD, and so forth, and in around this, and because in around this, the team encourages, or the KDOS team had also encouraged members to share lived experiences and raise concern outside of social media, outside of the social media platform, and so thus again to sort of prompt a basis in around sort of the literature in and around CKD, but also where service users for example have time out for themselves as well, and so in around this to highlight as well the issues that arise from those who suffer with CKD tend to be vast. The KDOS founders wanted to ensure that awareness of CKD in the young pediatrics and the young comes out into the forefront, and I want to be able to raise and inform a public's perception of this particular disease. Many people believe that, for example, in around CKD, where recipients, whether in pediatrics or in the adult population, for example, where a transplant has been sort of evidenced and documented as a cure, and this works from 2016. The authors have said that this is that having a transplant is a fallacy. A transplant is a treatment option, and this is another message KDOS founders have been looking to get in across. There needs to be more awareness and understanding of long-term conditions like CKD to preclude sort of larger issues on sensitive topics like discrimination and ignorance, which have a deeper impact, can have a deeper impact in later life. So in around the discussion around this works as well then. So discrimination potentially based on ignorance was all too obvious in has been all too obvious in works that have been documented in 2014 in a recording made during a what's been referred to as a fringe meeting at conservative conference on the 25th of August. The minister at that time, the Minister for Welfare Reform, Lord Freud, responding to a question from a councillor, said the following. This is a direct quotation from Lord Freud. Lord Freud, sort of retrospectively, he said, where Lord Freud said Lord Freud said the following: "You make a really good point about the disabled. Now I have not thought through, and we have not got a system for, kind of going below the minimum wage. There is a group, and I know exactly who you mean, where actually, as you say, they're not worth the full wage." So in around this, Lord Freud's views may not be limited to senior policy makers. Evidence also implicates academics, health researchers, and employers. Intriguingly, in around September 2015, an online edition of the Health Service Journal, or HSJ, authors has stated the following. This is a direct quotation as well: "The NHS workforce will increasingly need to attract and retain staff with disabilities." And so, in line to this now, some aspects about some additional aspects in around assistive technology. Now, assistive technology, for example, should be acknowledged and understood by employers for individuals with disabilities, allowing healthier work environments. More awareness has been required, or whether authors in this works have documented that more awareness is needed. Benefits from health support often go well beyond the health system itself, based on implication from works. Other investigations or studies have shown that employment is needed not only to provide living but to sustain mental health and well-being. Work fulfills a number of basic needs for individuals, such as collective purpose, social contact, status, and activity. A person with a disability or a long-term condition can often be isolated, and work is one way has been documented as one way to reduce sort of isolation. The KNAS team has per mentioned has already gone beyond social media or beyond social media platform, where in the example has been mentioned about the KNAS pit stop. In literature at the same time, in literature, peer counselling, or what's been referred to as documented as sort of peer counselling, is another way of fighting discrimination and ignorance. Specifically, this involves the linking of recent persons with disability and long-term conditions to individuals who have had a disability or a long-term condition for example, for longer durations, and the relationship would aim to in context around this as well, the relationship would aim to the relationship in around in context of what's been documented as peer support. The relationship would aim to help with understanding, share experiences, etc., and also prompt a basis in and around towards autonomy and self-determination. In addition, there's also a basis in and around providing sources of information, advice, support, and referral and assistance, and peer counselling. Also, so what's been documented as sort of peer counselling promotes a support and sort of mentoring between those who are egalitarian with each other. So in around additional support from what's been referred to as the Accessible Information Standard, making all forms of digital communication as easy to use by as many as possible has been one of the remits of w.3C's Web Accessibility Initiative. NHS England's Accessible Information Standard has been documented where the Accessible Information Standard has gone beyond. All service providers of publicly funded health and aspects of aspects around healthcare are obliged to support patients, carers, and parents with disability, in around disability, impairments, or sensory loss, directly or indirectly affecting communications. Channels of communication such as, for example, email and text, and methods for remote consultations have also been documented and covered by the Accessible Information Standard, and so to our provision of documents in alternative formats. So, for example, large print or easy read, and face-to-face support at consultations, for example, in around sign language or advocates. The standard is the AIC the AIS, the Accessible Information Standard, is also has been documented as being backed by law, underpinning the widely accepted moral and business cases, and so through new and still to become sort of embedded in routine practices, the standard would inevitably add to support the growing evidence in around and behind social media. And so to conclude on this works, so long term. So to conclude in around this particular audio podcast, audio podcast in around the Bostix Feature 3. So long-term conditions and disabilities are growing in prevalence, have been growing in prevalence and cost. Failure of healthcare systems to address these challenges is attributed in significant ways to the discrimination and ignorance of professionals and systems themselves, based on the stigma of consequential disability. Two examples, for example, from the from CKD, chronic kidney disease, have shown early evidence of genuine advantage for patients or recipients and families through social media, and for example, for example, in around Facebook, sort of retrospectively, and the need was the requirement was sort of evidence and developed and explained and had been sort of developed based on requirement and aligned to sort of co-development of digital and physical support as outlined. The message from this particular works that was published in 2016 by authors was and had been that social media has so much to offer in healthcare and beyond, and needs nurturing and support and needs nurturing, and in around this support and developmental research as a basis in around this as well. So that concludes this audio podcast in around the Bostix Rupture, the science of Traption. This has been an audio podcast aligned to a chartered edition and an evidence-based edition in around an evidence-based edition. This has been another the Bostix feature. This is the Bostix feature 3, and once again, this has been another Storm Bostix production. The work of the resources in around this sort of audio podcast will be in the descriptives on social media. So our listeners are more than welcome to check out some of the resources or the resources that are part of this, and the work, the research itself is accessible online, and the understanding is that the works, this research can be accessed by and through the organization, the Renal Patient Support Group, or the RPSG. This works was originally a collaboration between KDARS, the RPSG, and also colleagues at where there were colleagues involved from the health from One Voice Coalition for Accessible Information Communication Technology, and also by an academic at the University of Malta as well. So thank you for tuning in. This is hopefully been of intrigue, and hopefully there will be another the Bostix feature sort of prospectively. Thank you for tuning in.